Hello everyone, welcome to my YouTube channel. Today we are going to talk about blood products and massive blood transfusion, part 1. Before we start, there is a disclaimer. This video is for informative purposes only. I am advising you to refer to the main textbook or sources that is used in each teaching center respectively. Thank you. Now let's begin. In part 1, I am going to cover regarding blood products. These include A. Red blood cells, B. Whole blood, C. Platelets, D. Fresh frozen plasma, and E. Cryoprecipitate. A. In red blood cells, it is prepared from whole blood by removing around 250 ml of plasma. 1 unit of packed RBC should increase the level of hemoglobin by 1 gram per deciliter and hematocrit by 3%. Packed RBC are stored in SAGM, saline, adenosine, glucose, and mannitol additive solution. RBC transfusion are used to treat hemorrhage to improve oxygen delivery to tissues. Transfusion of red blood cells is based on case-to-case basis. Indication for RBC transfusion include A. Acute blood loss more than 1,500 ml or more than 30% of blood volume. B. Acute sickle cell crisis. It is for stroke prevention. C. Symptomatic anemia patient that presented with signs and symptoms like fatigue, dizziness, weakness, reduced effort tolerance, shortness of breath, changes in mental status. For B, whole blood. The advantage over packed cells are 1. It is coagulation factor rich. 2. If fresh whole blood, it is more metabolically active than stored blood. It is stored at 1 to 4 degrees Celsius. The shelf life is around 35 to 42 days. The first 4 to 6 hours, 100% of all the components are still retained. Changes with time for whole blood. What happens is the platelet will fall less than 1% by 4 to 48 hours. The clotting factor 5 and factor 8 also disappear in the same time. Other clotting factors like factor 2, factor 7, factor 9 and factor 10 thereafter. The potassium level will be increased. The ATP level will be down. The pH will be low. It will become more acidic, especially after 5 to 7 days of storage. C. Platelets. Platelet transfusion should be reserved in 1. Patients who are experiencing excessive post-operative bleeding and surgical cause has been excluded. 2. If the defect cannot be corrected, example in congenital platelet abnormality. 3. Hematological malignancies. Need more than 20 times 10 power of 9 is the safe limit unless patient has fever, bleeding, on antibiotics or coagulopathy. 4. Prior to procedure of A. Bone marrow aspiration and trifine biopsy, our aim is to get more than 20 times 10 power of 9 providing adequate surface pressure is applied. Prior procedure of B. Lumbar puncture, epidural, or GDS and biopsy. The aim is platelet count should be raised at least 50 times 10 power of 9. C. Operation at critical sites, example, eye and brain. The platelet should be raised at least 100 times 10 power of 9. 5. Patient need massive transfusion in acute bleeding. So aim of platelet to be raised at least 50 times 10 power of 9 and in multiple trauma or CNS injury. The aim is 100 times 10 power of 9. For disseminated intravascular coagulation, DIVC, the aim is to maintain the platelet count more than 50 times 10 power of 9. So calculation of dose for platelet transfusion. For a random platelet, the random platelet need to contain more than 60 times 10 power of 9 per unit. So usually the volume of random platelet is around 50 ml. 1 unit of random platelet will increase up to 5 to 10 times of power of 9. B. 1 unit of apheresis contain more than 200 times 10 power of 9 per unit. Its volume is around 200 to 300 ml. It is equal to around 4 to 6 units of random platelet. In adult, there's a formula. The platelet increment target times the blood volume and divide by the correction factor is 0.67. Platelet transfusion is contraindicated in 1. Thrombotic thrombocytopenic purpura TTP. 2. Heparin-induced thrombocytopenia HIT. 3. Casabat-Maric syndrome. D. Fresh frozen plasma FFP. The plasma is frozen soon after the collection or within 8 hours to maintain the activity of blood clotting factors. It can be stored for up to 36 months at minus 25 degrees Celsius or below. Indication for FFP transfusion. 1. For replacement of single factor deficiency where specific or combined factor concentrate is not available. 2. Immediate reversal of warfarin toxicity or warfarin effect in presence of potentially life-threatening bleeding when used in combination with vitamin K. 3. Treatment of multiple coagulation deficiency associated with acute DIVC. 4. Treatment of TTP, thrombotic thrombocytopenic purpura. 5. Indication of FFP transfusion is treatment of inherited deficiency of coagulation inhibitors in patient undergoing high-risk procedure where specific factor concentrate is not available. And 6. In the presence of bleeding and abnormal coagulation parameter following massive transfusion or cardiac bypass surgery or in patient with liver disease. Lastly, regarding E. Cryoprecipitate. It is prepared by thawing fresh frozen plasma and collecting the precipitate. Cryoprecipitate contains high level of concentration of factor VIII and fibrinogen. It is used in the cases of hypofibrinogenemia, which occur in setting of massive hemorrhage or consumptive coagulopathy, or there is evidence of low fibrinogen level. Cryoprecipitate is stored at minus 30 degree and it can last, the shelf life is about 2 years. Indication for transfusion for cryoprecipitate. Hemorrhage after cardiac surgery, massive hemorrhage or transfusion, surgical bleeding, anticoagulant factor VIII deficiency, and von Willebrand disease. So this condition is used when the recombinant factors are not available. I'm going to show you about the blood components in this picture. This picture shows the summary of blood products that have been described previously. After the blood is collected, it will be tested for HIV, hepatitis B, hepatitis C, syphilis, ABO compatibility, etc. etc. After that, the blood will be processed into a blood components, either for packed cells, the platelet, FFP, etc. Packed cell is stored at 4 degrees Celsius and lasts for around 35 days. Platelet can be kept at 22 degrees for 5 days. The FFP is kept at minus 25 degrees and lasts for 36 months. Packed cells need to be checked compatibility before giving to patient to reduce the complication of blood transfusion. Before giving FFP to patient, it need to be thawed. So that's all for today. See you in part 2 of blood products, massive blood transfusion and its complication. Bye.